In the previous episode, we had the chance to talk with Georgia.
My name is Georgia. I am 23 years old.
Who survived non-Hodgkin lymphoma. It is a type of white blood cell cancer. We did our readings and found out that this is one of those hard to find kind of disease. Therefore, in this episode, we'll be talking about signs and symptoms, early diagnosis, what makes you or your loved one more or less susceptible to the disease, and who are probably already at risk, and ultimately what can you actually do. And keep in mind that always consult with your doctor. Alright, let's start before it's too late. So how early can you actually detect non-Hodgkin lymphoma? As early as when you find yourself having some lumps or masses, either in your neck, armpit, or groin area. This is the most common and the most important sign to be looking out for when it comes to diseases that has to do with your lymphatic system. And just for the geek out there, for non-Hodgkin lymphoma, you would find the masses in an area that they would appear like altogether a few masses. This is to kind of differentiate between non-Hodgkin lymphoma with things like viral lymphadenitis or toxoplasmosis, because for those things you would only have like one lymph node protruding alone. Other than that, another early sign, not actually sign, but if you have a family history, you should also get checked.
Besides this, weight loss of about 10% in the last 6 months is a worrying sign. If it's accompanied by coughing, it probably means that the lymphoma has started within the chest region. You might also experience night sweats, fever, fatigue, or a swollen abdomen. What essentially causes NHL? We don't know exactly for sure what causes it, although we do know a lot about the genetic background and which mutations are responsible for it. However, there have been few associations that have been made in terms of what increases the risks of developing non-Hodgkin lymphoma.
First and foremost, it is your age. The majority of the patients are over 60 years old. Kids can also develop non-Hodgkin lymphoma, but they probably have a stronger genetic background. I mean, like suggestive of non-Hodgkin lymphoma. Other than that, like I have mentioned, your family history. If someone in your first degree relatives, meaning that people like your siblings, parents, or your own kids, if they have non-Hodgkin lymphoma, then you might carry some kind of mutation that is similar. Another strong risk factor is if you have been exposed to some certain virus, most notably HIV or Epstein-Barr or Helicobacter pylori.
Some additional points to include are also body weight or obesity, such as BMI, a high BMI, when your immunity is weakened somehow, or if you have autoimmune diseases, radiation or certain chemical exposure like insecticides or herbicides, or even the drug from chemotherapy for other cancers. It is more common in Western countries, funnily enough. In the US, Caucasian people actually have a slightly higher susceptibility than others, but it's not that big of a margin. Interestingly, there has also been an association with breast implants. Some women have developed a rare type of T-cell lymphoma known as breast implant-associated anaplastic large cell lymphoma.
Alright, let's talk about the most practical part. What can you actually do about it? Even though there's not much. For those who are healthy and don't really feel anything right now, what you can do is actually touch it yourself. Literally. What I mean is to try to palpate your neck area, your armpit area, your groin, to see if there's anything that is not bilateral, meaning that if it happens on one side but not the other side, and try to see if something that may not have been there before, or see if the mass, if there's a mass, if it's soft or hard, if it's mobile or you cannot move it, or if there are a few of them or just one of them. If you have a parent who is approaching this age of risk or already in the risk of having non-Hodgkin lymphoma, then what you can do is to try to palpate them. I can show you how to do it on Nick right now. We just learned it yesterday.
Yeah, we did.
This one is just for the neck area, okay? For the other area, just touch it randomly. Okay, what do we do now? I have to stand up, right?
Yeah, you have to stand up and I have to be sitting.
Okay. So for those who are listening, I will be, let's say, describing it a bit for the neck area, and I'm only gonna do the neck area, okay? Don't worry. For the neck area, what you could do is to start with the area before the ear, close to the joints of the jaw. Try to see if there's any mass. Do the same behind the ear. And then you move to the back of the head. And what you want to find is something slightly harder than normal. The area that you will be starting palpating is from the base of the skull, meaning like a bit up, and then you go all the way down, up to the most pronounced spine. And then you will go below the chin, and then you slowly go up to this part of the jaw. It's like the ending part of the jaw. And then you would go down to this muscle here. We call it sternocleidomastoid. You would do yourself like a grab, and you would grab the muscle. The muscle starts from kind of like the back of the ear, and it goes all the way toward the sternum. The sternum is the middle of your chest. So you would grab the muscle, go all the way down to the middle of the chest, just follow that muscle. And then after the sternocleidomastoid, where you would go is to go behind that muscle and before the trapezius muscle or trap muscle. Many people call it that way, which is between your shoulder and skull. And then you would go in front of your thyroid. You could also palpate the thyroid cartilage. Do the same movement, just touching slightly to see if there's any bump. And then the last area that you want to palpate in the neck area is above the clavicle. My professor said that if there's a mass here, it usually relates to something in the stomach, and it's going to be bad. So hopefully you will not find anything here. And that's it. Just to give you guys a general picture of what's going on in the world of medicine in terms of non-Hodgkin lymphoma or lymphoma in general, I did a simple, let's say, search on PubMed, just the terms non-Hodgkin lymphoma, pairing with the words like causes, prevention, and diagnosis, and treatment, to see relatively how much, let's say, research or paper has been written about it. As you can see, or I would say, for the causes is about 70,000 results, diagnosis 81,000 results, treatment 75,000, and for the prevention, guess what? 5,800 results. So the point I'm trying to make here, which is not definite, is that I do think, not just for lymphoma, for other things as well, a lot of effort is being put into finding out the disease to be treated but very little is being done on prevention itself. I do believe that, okay, it's true that there's no definite way yet to actually prevent it. Maybe that's why no one is having a look at how we can prevent it, definitely. But yeah, just an idea.
Alright, to finish up this podcast, let's mention some diagnostic methods and treatments. After the doctor takes your history and does your physical examination, in this case, he'll probably do the exact same thing Michael just did to me. If he finds something suspicious combined with some of the signs we mentioned, he would probably request for a biopsy, a blood test, and anything else that is necessary, some kind of imaging to find out where exactly the primary lesion is. After, if it's found, you'll go through treatments depending on the type of lymphoma and how far it has progressed. The treatments range from chemotherapy to stem cell transplant. Prognostic, aka how likely you are to be fine, depends on many factors, understandably, but it relies on age. People over 60 usually have a worse prognosis if the same type of lymphoma is found at the same stage.
Thanks for watching, and please share the video if you think that someone might benefit from it. See ya!
Thank you very much.